Hello. Hello.
Yes.
Yes. So, sir, it's 3, 2, 1. Sir, we are live now.
Do I start?
Yes, sir, you can start.
Good evening, everyone. I am Dr. Sumit, consultant urologist at Surya Super Specialty Hospital, Sahibganj. First of all, I would like to thank Lupin Pharmaceuticals for inviting me to this platform to speak on the topic of renal stones. Basically, it's a patient awareness program, and I would like to highlight points which are very important for common man for understanding the treatment modalities of renal stones. Slides. To understand the urinary, sorry, 1 minute. First of all, I would like to understand the system, the urinary system, which includes kidneys, ureter, bladder, and urethra. The function of kidney is to filter blood, which allows the metabolic wastes like urea, creatinine, sodium, potassium, etc., to be excreted from the kidney, that is from the calyces, through renal pelvis into the ureter, then to the bladder, and through urethra to the outside. The whole system is called as a urinary tract system. As we're dealing with kidney stones, so what are these stones? What are these made up of? These are hard stone-like masses, small masses. These are made up of salts and minerals. They can be formed in one or both the kidneys. These stones travel down the urinary tract and may pass out automatically. Kidney stones vary in size. Initially, they are formed as a Renal's plaque. Then they gradually grow in size. So, and later on they become bigger in size if they are not treated or they don't pass off. So small stones they can pass on its own, causing little or no pain, while larger stones they may get stuck along the urinary tract, blocking the flow of urine and causing severe pain, bleeding, or sometimes infections leading to fever and chills. Most stones are formed in the kidneys, but they can move throughout the urinary tract, and hence their locations differ. They can be found inside the calyceal system. It can be found at the pelvis, in the pelvis, or in the ureter, or in the bladder. And sometimes they may get stuck in the urethra in the course of passing through the urinary system. Now we come to the etiology, which includes metabolic factors, lifestyle factors, genetic factors, and drugs. This will be dealt on as we move through the slides. Approximately 12% of the populations are expected to have urinary stones. In India, stone belt occupies Maharashtra, Gujarat, Punjab, Haryana, Delhi, and Rajasthan. One important thing that patients usually ask, if we have a stone, do we have any chance of recurrence? So answer is yes. There is a 50% chance of formation of second stone within 7 years if they don't take preventive measures. Coming to the types of stones, these include struvite, calcium oxalate dihydrate, calcium oxalate monohydrate, cysteine, ammonium urate, and silica. Coming to the symptoms of kidney stones. A kidney stone may not cause symptoms unless it moves within the kidney or it passes in the ureter. This is a common question being asked by the patients. Sir, I never had symptoms. Now you say that I'm having such a big kidney stone. So the answer is that unless the stone moves in the system, it blocks the tract, it usually doesn't cause symptoms. Once the urinary system gets blocked, when patients are not able to pass urine and the system swells up, the capsule of the kidneys and ureters get descended and then it causes pain. So the first and the most common symptom of kidney stones is renal colic or ureteric colic. This diagram over here, this is the a site of renal colicky pain. There is severe pain that starts in the groin and may radiate up to that starts in the loin and may radiate and into the groin. There is severe pain in the side and back below the ribs, and that spreads down. So the first symptom is pain that comes on and off, that comes in waves and fluctuates in intensity. It's colicky in nature. The second symptom is a painful urination. That is maybe associated with dysuria. That is a burning sensation in urine. Urine may turn pink or red or brown. There can be foul smell in urine, or urine can turn cloudy. Severe pain may result in nausea or vomiting. There's always a persistent urge for urination. There's a frequency of urination increases. If stones leads to infection, then patients may have fevers and chills. Patient voids often, and hence they pass only very small amount of urine. If these symptoms are present, then the patient should always contact their local physician or doctor. Now coming to what doctors evaluate and how do they diagnose kidney stones. First is clinical evaluation. Patients will have symptoms like pain, blood in urine, burning sensation in urine, frequency of urination, urge in urination, may be associated with fevers and chills. The clinician also asks about the lifestyle. Does the patient have sedentary lifestyle, or there's a decreased fluid intake history, or does it take diets which are prone for stone formation, like foods rich in salt, animal proteins, and oxalate, or foods that are poor in calcium and citrus. Then he evaluates clinically by that physical examination. There can be history of, there can be fever, there can be lumbar or renal angle tenderness. Then there's medical history, which includes drug history. There are some drugs which are prone for renal stone formation. These include ephedrine, triamcinolone, endenavir, ciprofloxacin, sulfur drugs, etc. There are certain medical conditions that are prone for formation of stones. These include gout, frequent UTIs, inflammatory bowel disease, chronic diarrhea, sarcoidosis. Now coming to family history, patients who have gout or parathyroid disease in the family, again, are prone for kidney stone formation. Surgical history, especially abdominal surgery for obesity, these patients are also prone for renal stone formation. Coming to the diagnostic modalities for finding the location and size of renal stones. Most commonly available tests are ultrasound and X-ray. When both are used together, they complement each other and are a better diagnostic modality together when used. And CT KUB, that is a non-contrast CT, kidney, ureter, and bladder. This is a diagnostic modality of choice for diagnosis of renal stones. When we use contrast in CT KUB, this also gives an idea about the planned surgery, if required, for the treatment of the renal stones. CT scan also provide many ideas like degree of hydronephrosis, that is swelling in the kidney, the degree of function that is lost due to prolonged stone blockage, and it also gives other diagnosis about kidneys, especially perinephric standing, infection, etc. Next is urine examination. Urine helps to know what are the substances that it contains. It can the first is pH. If pH is less than 7.5, it could be lead to infectious stones, non-infectious stones. If pH is more than 7.5, it would lead to infectious lithiasis. Second is presence of crystals, like we can see uric acid crystals, oxalate crystals, etc. in the urine. Then we can also find out if there are any infection like bacteria that can be seen in the urine. Besides, it also helps in metabolic evaluation of renal stones. those patients who are prone for recurrent renal stone formation, like patients will have hyperoxaluria, hypocytaturia, hypercalciuria. So urine helps in the examination in this ways. Blood tests. Blood tests are important. Supposing a patient has fever with chills due to stone, we can know the degree of infection that patient has through counts and CRPs. Second is metabolic evaluation of renal stones. Like we can undergo tests for renal stones, like recurrent renal stone formations, like amount of calcium, oxalates, etc. in blood, to know what metabolic disorder patients have that leads to the formation of stones in a patient. Now coming to the treatment modalities that we have. Treatment is either not necessary for small stones. These stones either are lying idly in a renal system or they pass off normally. Only pain medications are needed. Treatment is needed if symptoms are present or if a stone blocks urinary tract. So at this point, consultation with urologist is necessary. Now coming to different modalities of treatment by a urologist. First is lithotripsy, second is ureteroscopy, and then doing PCNL is the third modality. These are the three most common modalities. So what is lithotripsy? It's extracorporeal shockwave lithotripsy. Now, the idea is that the stones which are lying inside the kidneys are bigger in size, and so they won't pass off easily. So we give shock waves so that these stones fragment and then they pass off easily. But this procedure has been known for poor success rates and showing with high risk of ancillary treatments for residual stones. There are stones that may fragment and they can even block the ureter, and then they require ancillary treatments for their removal. And it's not a very good choice for very hard stones. Usually it is used for smaller stones, that is less than 1.5 centimeters, and hence it can't be recommended as a universal treatment. It's only a selective treatment for certain types of stones and up to a certain size only. The next modality is ureteroscopy. If a stone is lying inside the ureter, or even a stone lying inside the kidney, can be treated with a ureteroscope. Ureteroscope is basically a long tube-like structure that can be negotiated through the urethra into the ureter, and a flexible ureteroscope like this can move into the kidney also. So once the stone is localized somewhere, then it can be fragmented either by pneumatic lithoclast probe or by use of laser, and then it can be retrieved through baskets. The third modality is percutaneous nephrolithotomy. Here we make a puncture through the skin into the kidney and put a guide wire, and with the help of that we dilate the tract, and then we place an appendage sheath, and through this we pass a nephroscope, and then we fragment the stones and then pull them out. And it is a treatment of choice for large renal calculi, and then it can be used for any kind of renal stones. Now coming to the other aspect, that is prevention of renal stones. This is the most important question that every patient asks a urologist after treatment. Sir, what should I do so that the renal stones don't form again? The most common cause of formation of renal stone is dehydration, resulting in supersaturation of substances in the urine that lead to formation of stone. So we should drink enough water and throughout the day. The target should be around such that your urine is clear and daily output is approximately 2 liters of urine per day. That means the total intake should be around 2.5 to 3.5 liters of water that should be taken per day. So people who are not drinking enough water and those who live in warmer climates or those who sweat more are at a higher risk. So we advise them to drink plenty of water. So how much water should be taken? That is 2.5 to 3.5 liters of fluid per day. Water is the best kind of fluid, but then citrus drinks are also helpful in prevention of renal stones. Citric acid in urine has been known to be an inhibitor of stone formation, and hence citrus fruits should be taken. At this point, I would like to make a note of hydrotherapy. Previously, it was supposed to be a modality of treatment for flushing out stones in urinary tract. But when we drink lots of water, a stone in urine, in urinary tract, that has blocked the system may result in further aggravation of symptoms, may result in further pain, further aggravation of infection, and hence it is not being used now as a therapy for stones that have already blocked the urinary tract. It's better to remove the stones via operations. So drinking water is most important. Coming to the diet, if patients have oxalate stones, so rich foods that are rich in oxalates should not be taken or should be taken in a restricted manner. These include rhubarb, beets, okra, spinach, sweet potatoes, nuts, tea, chocolates, soy proteins. So those patients who have calcium oxalate stones, they are directed to restrict their diet in oxalate-rich foods. Second is diets should be low in salt and should also be low in animal proteins. So reduction of the amount of salt that one eats and choosing a non-animal protein sources is legumes is recommended. Non-animal proteins, that is vegetable proteins like legumes, are not known to increase the chances of stone formation. It's only the animal proteins that should be reduced in consumption. Restriction of diet that in salt and animal proteins is required. Third thing is calcium. When I say you can consume milk, you can consume foods that are rich in milk, despite you have urinary or renal tract stones. So patients, they give an exclamation, why, how is it possible that when we have stones and we are allowed to take calcium containing foods? What we suggest is that patients can take calcium rich foods, but they can't take additional supplementation of calcium because calcium containing foods are known to combine with oxalates in dietary tract, in intestinal tract, and hence they decrease the chances of oxalate stones. So calcium rich foods are must, otherwise patient will have chances of oxalate stones. What we recommend is the diet which is low in salt, which is low in animal proteins, with moderate amount of calcium intake is required, is an ideal diet for patients who have prone to form renal stones. To summarize, kidney stones have a high chance of recurring if not managed properly. The most important factor is the urine output, which is to be achieved per day is more than 2 liters per day. So daily intake should be around 2.5 to 3.5 liters of fluid per day. Dietary changes should be made for prevention of recurrent stones. We should eliminate soft drinks acidified solely by phosphoric acid, and we should increase calcium-rich foods and limit oxalate containing foods. Thank you.
Hello.
Please.
There are some questions in the
chat box, I believe. The question is, what is the maximum size of a stone that can be out out of body without operation? There is no such size. I have seen even 3 mm stones blocking the urinary tract and causing severe ureterocolic, requiring urgent operation and removal of stones. As all the 5 fingers are not of the same size, similarly, urinary tract, the ureters are not of the same size. Some people have very narrow urinary tract ureters, and even a very small stone can block the ureters, resulting in edema and aggravation of pain, infection, and they require operation.
Hello.
Yes.
Sir, I don't know there are no windows. So can you look for another 1 to 2 minutes? Any question?
I couldn't get you. Hello.
Hello.
I couldn't get you.
Can you wait for another 1 to 2 minutes? If any question comes.
Sure.
Hello.
Roshni, please tell me.
Yes, sir, I think there are no questions. So, with your permission, can we conclude the session?
Yes, I can.
Okay, sir. On behalf of the organizer, we would like to thank you for your insightful and educative talk. Thank you so much for your time. So, sir, now I'm ending the meeting. Thank you.
Thank you.